Hi, everybody. I'm Gabriella Maffei, Superintendent, and we're just waiting to let people into the webinar. We'll get started in just a few moments. We're going to get started in just a few moments. The reason you're not hearing anything is because we haven't started yet. We're letting folks in. This is a webinar, so you're not going to be able to see your names and faces on there. And chat has been disabled for now because we're not going to be having chat, and I think until later on when they have some questions. Dr. Sayas, will you please check your message?
Yes.
Thank you. Also, if people don't have the setting to hide non-video participants, they're going to see everybody on there. We're going to get started in 30 seconds. So I think we're going to need one more round to mention about interpretation. Ms. Jackson?
All interpreters have been assigned into their channels. At this time, everyone can click on the globe at the bottom of their screen. Dr. Sayas, can you go to the third slide, please? Perfect. So if you're just joining us right now, interpretation, the feature is at the bottom of your screen, the globe icon. You're going to click on this globe icon and select the language. Thank you.
Okay. Ms. Sayas, Dr. Sayas, would you please move forward, and we're going to get ready. Okay. Our host. Slight technical difficulties. GGUSD, Mr. Mora, would you please We're going to be turning on chat when it's time for question and answer, but I know right now for the panelists, we want to allow them to get to their presentation. So we'll put that back on when the time comes. Okay, so welcome everybody. My name is Gabriella Maffei. I'm the proud superintendent of Garden Grove Unified School District. And this is, I'm just concluding my 8th year. Sorry, all of a sudden the air conditioning came on in the office and I can hear it. And I'm here very proudly along with board member Miss Terry Rocco, who I know wants to say hello to everyone. So I'll introduce her to you.
Hello, good evening, everyone. Thank you, Dr. Maffei, our GGUSD staff, and the Orange County Healthcare Agency doctors for providing us with this information and updates and answers to questions. And I hope everybody comes away feeling that this was definitely worth spending your time here. Thanks.
All right, so this evening we are very pleased to have with us two wonderful doctors from the Orange County Healthcare Agency. And they're here tonight to talk to you a little bit about vaccinations and the status of COVID-19. In Garden Grove Unified School District, we have something called the Garden Grove Way. And that refers to how we support students with their academic skills and their personal skills for lifelong success. Next slide, please. So this evening, we're very pleased to have Dr. Zimmerman and Dr. CK, she gave us permission to call her CK, to talk about vaccines and the status of COVID-19. I know some of you parents out there might be interested in knowing what's going to be happening in the schools for next school year around masks and distancing. That information has not been published by the state yet. That is expected to come out hopefully sometime this week, but certainly by the end of the month. And we will be communicating directly with parents as we receive that information. But for now, we wanted to make sure all of our parents who have questions about vaccinations for themselves, vaccinations for their students, as well as what's happening with COVID-19 at the county level in the County of Orange, to have the answers to those questions. That's been something that's been frequently requested. So we're hosting this to defer to our experts in our county, Dr. Zimmerman and Dr. CK. I'm going to turn it over to them at this time.
Thank you. I'm hoping that everybody can hear me okay, because I know we didn't do a sound check. Can you hear me okay?
Yes.
Okay, perfect. So I'm Dr. Regina Chincio-Klong. I otherwise go by Dr. CK, and I'm your Deputy Health Officer. I've been involved with helping to vaccinate everyone at the super pods, and we're so blessed to have Dr. Christopher Zimmerman, who's also here with us from the healthcare agency, working in communicable disease. He actually has expertise working with the CDC as well as WHO. It's a great time right now. It's June 14th, and who knew that we would have all these different vaccines available to vaccinate our communities. And we're so close to getting almost 70% over the past 18 months. Unfortunately, over 250,000 residents in Orange County have had COVID, and there's a cumulative death count in Orange County of over 5,100 of our residents who passed away. And this is a daunting number. You know, even one life that could have been spared is worth sparing from this awful illness that could be preventable. Currently, hospitalized cases, about 55 cases are still in the hospital, and 11 cases are in the ICU. So COVID has not gone away. We are still in the pandemic, even though I know that when you walk around, when you drive around the county, there's a lot of open restaurants and shopping and stores and amusement parks. We all still have to be very careful and mindful. And just like Dr. Maffei said, we are all still waiting for the guidance from the state, which should be coming out shortly with what the recommendations are for the upcoming fall. I think the best thing that we can do right now is really understand COVID, where it is right now, and what we can do to prevent further spread of the illness. Next slide. So we're just going to go over brief introductions, which we already did. What's the status of the COVID cases? What is our vaccine progress in the county? And what is this information about Vax for the Win? how to schedule appointments, and then we'll jump into questions. Next slide. So as we know, COVID has significantly impacted individuals as well as whole cities and our county as a whole, as well as our state and our nation. People can have minimal symptoms to severe illness and even death. And even with those who have mild symptoms, we really don't know what the long-term impact is. And we also already know that this illness has caused a lot of social, behavioral, mental health conditions to rise in our communities. And we all know children have been significantly affected, whether or not they had COVID, because they've been stuck at home without playing with their friends for quite a long time. We do know that also kids do get sick. They do get the illness. And again, some of the kids have been hospitalized. There's obviously significant financial impacts to individuals, families, as well as the county. So we're hoping to reach a high immunity in the community to minimize the spread of the illness and to also slow the variant transmissions. You're probably already hearing on the news that there's all kinds of variants circulating, especially something called the Delta variant. But in order to minimize and slow the variant spread, we need to all vaccinate our community. Next slide. So this is a table of, I just pulled this up from the CDC COVID tracker. This is how many people have been affected in the United States, and we're getting closer to 600,000 deaths in the United States as a whole from COVID. And if you see there, California has the highest number of cumulative child cases of COVID, because we have the one of the largest populations. And you can see all the states that follow. Next slide. At one point, the COVID rates in our pediatric population actually rose to almost 24%. And this really is because more recently, we've had more of the adults who are vaccinated. So we're seeing a rise in the percent of pediatric cases, since many of the pediatric cases have not yet been vaccinated. Next slide. And actually, this is current as of the 9th of June. You can see there that the pediatric cases make up 22.5% of the current cases in California. Next slide. And we do see that after initially decreasing, the adolescent hospitalization rates have increased because, again, we're comparing, or the rates are increasing because already a lot of the adult population has been vaccinated. So the only ones left who are getting COVID, unfortunately, are the ones who have not yet been vaccinated. And this really points to the reasons why we should encourage all those who are eligible to get vaccinated as soon as they can. Next slide. There are many resources, and so hopefully this slide deck will be shared with all of you. Our local American Academy of Pediatric Orange County chapter has many resources on their website, and CHOC also has resources. And there was recently a media a recording with Dr. Singh and Dr. Williamson, and so hopefully you guys can listen in on that. I believe there's also an event that's happening this Thursday with Dr. Williamson, Dr. Singh, and Dr. Chow to further talk about COVID and adolescents. Next slide. So where are we at with vaccinations? The state as a whole has administered over 38 million doses to date, and over 65% of the 12 and above population has received at least one dose. So we're getting so close to 70%. Hopefully we'll get there by July 4th, but it all depends on our communities to get vaccinated. Next slide. Orange County is right around, it has the same numbers as the state almost. I just checked today, and 66.3% of our eligible population has received at least one dose, which is amazing. 56.7% of our of those who got vaccinated were actually fully vaccinated. And above 85% of our 65 and older population has received at least one dose. So we're doing great, but again, we're not quite there at 70%. So if you have family, friends, or loved ones who have not yet decided to get vaccinated, now is the time to consider it. Next slide. And if you didn't know, our state actually has incentives now to encourage people to get vaccinated. And already 2 OC residents have been selected for a 50,000 cash prize. So hopefully those residents have already been contacted. We still have one large drawing tomorrow, 1.5 million. So 10 winners will be chosen from our California Immunization Registry database. And each winner will receive 1.5 million each. And that does also include 12 and older who have received at least 1 vaccine. You do have to live in California. If you are selected, the state will do everything they can to try to contact you with the numbers that you gave whoever vaccinated you. So I guess we should all stay close to our phones to make sure we get that phone call when the state calls. If you need more information about this, you can go to covid19.ca.gov for more information. Next slide. And I know that many of you probably heard that our super sites have closed. Their last day was over a week ago, but we still have a lot of mobile pods throughout the county. And the way you can find those appointments is to go on My Turn, Othina. You can also go on vaccines.gov. I know when I'm driving on the freeways, I see on the signs, go to My Turn to find an appointment. All of our mobile pods on the county efforts are also listed on My Turn. So it's a great resource for anyone who's searching for a COVID vaccine. You can also, next slide, contact our hotline, 714-834-2000. If you initially received a vaccine at one of our super pods and you still have to get your second dose, but you don't know where to go, you can look at your app or call our hotline to help schedule the second appointment. Next slide. And this is myturn.ca.gov's website. They also have a hotline that you can contact if you have any concerns or challenges with getting assistance. Next slide. So we're going to open it up to Q&A, and we have Dr. Zimmerman also on the call. He will actually lead all of our vaccine efforts from the HCA perspective. And again, as I mentioned, he does have a lot of experience with vaccinations and pods. Actually came to us from the East Coast and worked previously with the CDC and WHO. So we're so lucky to have him on the call as well.
Pleasure to be here. Will someone be reading out questions? Are they coming in from the chat or from?
Actually, I think they're probably going to read it out to us. I see one question that was asked earlier in our before I presented. And of course, I'm sure there's a lot of questions about this. Can we cover the information about myocarditis or inflammation of the heart and what's been seen in teens?
Sure. So let me just start with, there's 2 conditions that have been talked about. Inflammation of the heart muscle, what's called myocarditis, and pericarditis, which is inflammation of the lining around the heart. And those are rare conditions, but they have happened before COVID. We see them sometimes from viral infections, sometimes from the body's response to infections. So these are not new conditions. They've existed before. They're rare. What we've seen is that particularly among the 16 to 24-year-old age group, that we're seeing more reports of this myocarditis and pericarditis than we would have expected. Now, and I'm looking at the data that was presented at a meeting just last week, at the end, and it's data through the end of March. Out of 11,000 vaccinated, there's a couple hundred cases of these conditions, myocarditis and pericarditis. And what we've seen is they seem to present within a few days, although there have been cases reported later of vaccination, but they've been very mild. Usually young boys more than girls have been presenting with some chest pain, sometimes some shortness of breath. Sometimes they feel like their heart's racing. Usually with some very basic medications, their symptoms have resolved. So we're not seeing serious side effects from this. It's been with the mRNA vaccine. So by those, I mean the Pfizer vaccine or the Moderna vaccine, the two that are given as 2-dose series, and more commonly after the second dose. Now, they're still gathering data on this. This is an evolving situation. Some of the safety monitoring systems that they have set up have not seen this increase in cases. So I think the experts are still trying to understand this and gather more information and see whether there's reports that haven't come in. So it's something that we're looking at. But again, what we've seen is very mild. And, you know, as Dr. CK presented in terms of the benefits of vaccine and the fact that this disease continues to impact all of us, including youth, you know, that the risks of being vaccinated are far outweighed by the benefits, that people should get vaccinated, even though there may be small risks of potential side effects. But we'll continue to monitor this situation. But the bottom line is we continue to encourage people to vaccinate themselves and their children against COVID-19. Follow-up questions?
I know there's a lot of questions. I'm trying to look at the chat as you're speaking. So thank you for providing that summary. I know, so I'm going to try to get through this list. There was a question about where can I find the full ingredient list of the CDC COVID-19 vaccines. These actually should be on cdc.gov. And I'll just have to find the link to it. But all of the ingredients are listed for all of the vaccines on that website. There was a question of will masks be required when school starts in the fall? That will all depend on the CDC and the CDPH recommendations, because there's so much of the pediatric population that has not yet been vaccinated, even by the fall semester, especially those younger than 12. I suspect that masking will still be strongly recommended in the K through 12. Okay. Then there was a question of co-administration of other vaccines. Can a child get different vaccines all at once with the COVID vaccine? It is now recommended that yes, a child can get all the vaccines at the same time. It is actually recommended because I know a lot of the pediatric population has fallen behind with their vaccines, including Tdap and flu vaccines. So if you have a pediatrician, now's the time to go see your pediatrician so you can get all the vaccines and catch your child up with vaccine. What is the timeline for vaccines for those who are under the age of 12? We suspect that the COVID vaccines may be approved for use in the fall. I know that Moderna, Pfizer, as well as Johnson & Johnson have ongoing studies with those under the age of 12. And again, the prediction is that hopefully we'll have an EUA approval by the fall. Moderna already has submitted information about their study results for those who are age 12 to 17. So we are also waiting for FDA to give approval or EUA approval for under 18. But right now, the only vaccine that is EUA authorized for minors is Pfizer, which is a 2-dose series.
I'm just going to add, so there's a couple different things. One, Pfizer and Moderna may get FDA approved for their current indications, and that might well happen in the fall. In terms of going down to younger children, but perhaps down 6 months and up, the most recent things that I've been hearing have been that may not be till the end of the year.
So there was a question. My son is turning 12 after sometime later in June. When can he get his first vaccine? As soon as he is 12, he can go ahead and get his first vaccine. So everybody currently, if we have to wait till the child is exactly 12 before they can start their COVID-19 vaccinations. I know I've seen a lot of families bring their children to the sites for, some special needs children or some who have, who are very high risk and they were under the age of 12. At this time, at least for the HCA vaccination pods, we are only vaccinating for the eligible age according to the EUA. So we're not vaccinating under that age. There's a question, why are we pushing to vaccinate kids when they are at such a low risk? I think the hard part, after June 15, children are really active and, when they play, they can touch things. We really want them to be able to play and have fun, but they are also at risk of getting significant side effects. While we haven't seen as high numbers of severe illness, we have seen significant illness in several cases here in Orange County. For instance, you may have heard of something called multi-inflammatory syndrome in children as well as adults. We have actually had those cases here in Orange County. And CHOC, I think I'm trying to find the number here. In CHOC, there's actually 76 cases of these that were admitted over the last couple months. That's a significant amount. And unfortunately, we don't know how long those kids will be affected by the long-term effects. And that just includes the multi-inflammatory syndrome. It does not include long haulers. Children are also at risk of having long-term side effects. So hopefully if you have time to join in on the call on Thursday with Dr. Williamson, Dr. Singh, and Dr. Chow, you can hear more about the CHOC experience and how many significant cases the infectious disease experts at the hospitals have seen. Hopefully that will give you more information to help you make a decision.
Let me add just a couple points on that. Certainly children are at much lower risk for death than we see in the elderly, but they're not at no risk. So vaccinating them is a way to decrease their risk further and protect them. The other is that there are people, because they may have problems with their immune system or they may be allergic, who aren't eligible to receive the vaccine. And those people may be at higher risk for complications. And the more we vaccinate the rest, as much of the population as we can, is the best way to protect those people who can't get vaccinated. So there's a couple, both for protecting children, get them vaccinated, but also for protecting everybody else.
Thank you. Great insights. So I'm going to try to read this. So if Dr. Fauci and Bill Gates have said that the COVID vaccine does not protect you from catching any other sickness virus, including COVID-19, why are we encouraging the vaccine? My friend's daughter took the vaccine and now she has a constant nosebleeds. Why are you forcing the vaccine? I think if anything, we're encouraging the vaccine because we see the significant effects it has had already on many people in our county. We also, again, there's so much more to learn about COVID, and the more that we can protect everyone from COVID and the downstream effects, the better off we are as a county.
Right. I mean, 5,000 people died from this disease in this county. Over 500,000 people in this country have died from this disease. And if you look at the rest of the world, the numbers are staggering. This is a disease that's taken many, many people's lives. And we're trying to vaccinate people to prevent the spread of this disease and prevent further deaths.
Right. And as you hear on the news, you hear of all these other variants that are coming that are now in different countries, including our own county. So, you know, we first learned about UK variant several months ago and how it was much more infectious and how people had more severe illness. And now you've probably also heard of the India or the Delta variant. That is also here in Orange County. So for those who are not yet vaccinated, it's only a matter of time that you may come into contact with someone or in contact with the surface and potentially get exposed to one of these variants. And if you do not have the vaccine, then you are at risk of having the illness. So, I mean, the best thing we can do is try to protect everyone in our county by getting vaccinated. That being said, now the next question is, are the current vaccines effective against these newer variants? What we do know is that all three vaccines that have been EUA approved or authorized are actually effective against the UK variant, as well as the Delta variant and other variants. There might be a slight decrease in efficacy compared to what we saw originally in the studies, but we do see that they are effective. So it's very important to consider getting vaccinated if you haven't already gotten vaccinated.
I'm looking at a question that says, can someone who is fully vaccinated get COVID from a non-vaccinated person? And, you know, none of these vaccines are perfect. Some of them are highly effective. You know, the initial studies showed, you know, 95% effectiveness. You know, that still means that out of 100 people, 5 people who were vaccinated could still get disease. So they're very good, but nothing is perfect. And again, this is reasons why we want to push the vaccination rate as high as we can, because the less people who are susceptible, the more people protected, the less the virus can go from person to person to person. If we can break the chain of the virus going from person to person to person, we can stop it. But it really requires, you know, high levels of vaccination for that to take place. The second part of that question is, it's similar to the one that you had just answered, Dr. CK. Can the current vaccines protect against the new COVID variants? And as was said, all of our vaccines are currently effective against the variants that we've seen out there. All those variants are variants of concern. We haven't seen one that completely escapes a vaccine that we have.
I think there's a question about mortality rates. As far as I know to date here in Orange County with pediatrics, there's only been one mortality. This was with someone who had significant comorbidities. But I know that there have been cases of deaths in other states. Actually, if you go back, if someone is going through the slides, if you can go back a couple slides, there's a slide on cases and deaths associated with COVID-19. Maybe we can show that because it will actually show that they're perfect. So this was the percent of the population in California who passed away by age group. And you could see there have been some cases of deaths in California in the pediatric group. There's a question, since there are no vaccines for children under the age of 12, how risky is it to send kids back to school? And what about kids that are high risk with asthma? Will the 6 feet distancing requirement still be in effect? We're going to wait for CDC and CDPH to come out with their guidance, which should be coming out in the very near future. What I do know is most likely those who are in K through 12 will likely be recommended to continue the mask wearing because by the fall, we probably still won't be able to vaccinate those who are under the age of 12. In terms of the distancing, we'll follow again what the CDPH recommends and what the studies show. And then how risky is it to send kids back to school? We do know with all the different measures that we took as a county with the distancing and the masking, there was actually low transmission of COVID. So as long as we continue to follow those, or as long as our case rates remain very low, it should be very safe for your kids to return to school in the fall.
I'm seeing once I get COVID, I have immunity. Can I still get COVID if I get the injection? Certainly we see that people who get infected by COVID are unlikely to get infected again in the short term. Usually we've been saying 90 days. We do see people who were infected with COVID and then 4 or longer months later are again positive for the virus. So it looks like reinfections can occur. We don't really understand how long is the protection from natural infection, which is why the recommendation is that everyone who's eligible should get the vaccine so that we're at least all on an even playing field. But that's a question that we still don't have the answer to. How long will immunity from natural infection? How long will immunity from the vaccination last? Those are open questions right now.
And then I have a question here. I've seen people become magnetized as a result of getting vaxxed. Why is this happening to people? So not really understanding, I tried to look into this too, because I think I was talking to a parent who was being observed after her whole family was getting vaccinated. And she brought this up, and it was interesting. As I looked online to understand what was going on, my assumption is that perhaps, like if you put a paperclip to yourself, it's really just the moisture on your skin that allows it to get stuck. But really, technically, there is no metal in any or magnet in any of the vaccines that are provided. And I can't really explain the magnetization. I know I've received my vaccine and I've tried it myself and nothing sticks to me. So, I'm not sure, what people are, I think there's TikTok videos, but what we know right now is there's no magnets, there's no metals in any of the vaccines.
I'm going to answer. There are some questions specific to, if Mr. Mora will put me back on video just for a moment. There are some questions specific to Garden Grove Unified School District and what we will be doing. So I just wanted to remind everybody, I mentioned at the beginning, but if you join us a little later, we are still waiting, and Dr. CK has mentioned, we're still waiting. The state of California, the California Department of Public Health issues and will issue revised guidelines for schools. Those haven't come out yet. So we will be informing you. I know some of you are parents in our district and some of you may be parents in other districts. Every district where the children attend will be sending out information. Those school guidelines will be our new guidelines that are going into place. We anticipate them by the end of the month. We were hoping we would have them this week, but we don't think that we will. Somebody asked also about Cal OCHA. So Cal OCHA are the guidelines for employees. So there's two different pieces that school districts have to do. One is for the California Department of Public Health, the school guidelines for children and for people who work in schools. And then Cal OCHA, which is for all employees. Both of those groups have yet to put out their new guidelines. And as soon as they do, we will send that information to our employees for Cal OCHA and to all of our families around what the California Department of Public Health indicates. As of now, we have no plans whatsoever. It would be a state decision to say vaccinations are required. I do not believe the state has any plans to do that. We are not saying vaccinations are required. And we see from some of the comments that people are not interested. This workshop is really for those who are interested to ask their questions. If you feel vaccination is not right for your child, then that is your option. And so right now there is no plan that I've heard of from the state of California, and therefore no directive for us to have students be vaccinated. And in fact, only 12 years and older can be vaccinated at this point. If you have a child younger than that, you can feel very safe and comfortable sending your child to school, even though they're not vaccinated, unless they have very special health conditions that you're concerned about, because there hasn't been the spread of COVID-19 on our school campuses. It's very safe to send your children back. However, there have been some questions, Dr. CK, about children who have asthma and other issues like that.
So for kids who have asthma or other underlying conditions, including diabetes, I would strongly recommend that families really consider getting that individual vaccinated, because we already know that COVID is a respiratory illness. It does affect the respiratory tract, and the last thing you need, especially for asthmatic, is to make their asthma worse. So getting the vaccine is very important. We know in the adult populations, and as well as pediatrics, those who have diabetes also are at higher risk because of the receptor and how COVID illness affects the body more easily. So if you have a child with many different health conditions and that's chronically managed by a physician, you should really consider having your child immunized.
Yeah, I mean, diabetes and asthma are conditions that may increase your risk for getting complications of COVID, for getting sicker from COVID. And yet we have not seen any evidence that the vaccination adversely affects those with asthma or other chronic medical conditions.
I know that there was one question too, will the COVID vaccine interfere with regular monthly allergy vaccines? It should not interfere with your regular vaccines, but if you want, it's still worthwhile to have that discussion with your allergy specialist, because everybody's on different types of medications, and even if you say maybe it was an allergy shot, that can mean many different things. So still have that conversation with your specialist of can you get the vaccine? When is it appropriate? Does there need to be special timing between the vaccine and other medications? There's also some questions about, will the vaccine give you immunity, or will COVID itself give you immunity? And what we do know is if you were to get natural immunity from COVID, we just, like Dr. Zimmerman had mentioned, we don't know how long that lasts. What we do know is after 3 months, some people show a decline in some of their antibody levels against COVID. So even if you've had COVID, it's still recommended that you get the vaccine so that we can boost the immune response in hopes that you don't get reinfected, and in hopes that you get less severe illness if you are to get reinfected. So even for those who have had COVID, still strongly recommended to go ahead and get vaccinated. I think we got through most of the questions. I don't know, maybe I missed some though.
There were several questions about the rumor that there's some sterilization aspect, that people will not be able to have children.
What we do know with the studies with Moderna and Pfizer is that the earlier phase 3 trials, what they try to do is exclude anyone who is potentially pregnant or getting pregnant from the study. However, what they did see, even though they did the exclusion, is that people did get pregnant. So actually, it was the Pfizer study that showed, I think it was about 13 cases that became pregnant after they were vaccinated. So that indicates that, it's a good sign that for those patients, it didn't affect their fertility. There's still a lot to learn about the vaccines, but as far as we know, to date, we don't think that it affects fertility, but again, we'll have to follow the science. Maybe Dr. Zimmerman, do you have any further comments?
Yeah, there's certainly data supporting that it's safe. There's not a really, we don't see issues with fertility with other vaccines. We haven't seen issues with fertility with the disease itself. So, we'll continue to be monitoring for side effects of vaccination over time, but from a scientific standpoint, that's not something I would be concerned about at this point.
I think my biggest concern is, if one of my friends, family members, loved ones actually got COVID itself, what are the impacts to their health? And when you look at the significant impacts it could have on your health, inflammation, the effects on the brain, the heart, all of the organ systems, I think when I think about that, that makes me more concerned than even what I've seen with people concerned about their side effects from the vaccine. It's one of the reasons why, I strongly encourage the vaccine, especially for this COVID-19 during this pandemic. There was a question, is there a correlation between low vitamin D levels and people getting COVID? It's been a while since I looked at that data, but I do know it's really important to have good levels of vitamin D and every other nutrient and really eating a healthy diet because it can help support your immune system. But I'm sorry, I'm going to have to look back at that data before mentioning anything. I don't know, Dr. Zimmerman, have you looked into the vitamin D levels and how it affects rates of COVID?
I know I've seen some papers. I wouldn't quote anything. I would agree with you. I think certainly people who are maintaining their health, eating well, are things that you can do to protect yourself from all sorts of diseases. And certainly, if your health's impaired, if you have chronic conditions, we know those are things that are associated with increased risk for complications of COVID. So certainly maintaining your health is important for everything.
Thank you. And there's a one statement that there's a lot of articles and testimonies about females having altered menstrual cycles and should they avoid getting the vaccine for now. So menstrual cycles, I'm female, so I can speak to this, but our menstrual cycle is so sensitive to everything, whether you didn't sleep enough, you didn't eat, you're stressed out one week, you have finals the other week. And so it could be that just the stress of, just thinking about getting the vaccine and then getting the vaccine may actually alter the menstrual cycle, but that does not mean that it affects your fertility. So what I would recommend is I would still strongly recommend every female, whether you're cycling or not, get the vaccine. Again, my biggest concern is we don't even know the long-term consequence of a mild, moderate, or severe illness beyond the actual illness itself. Previously, I love looking into integrative things, and I love the question about vitamin D, and I'm going to have to look back in the books. But when I researched a lot about the integrative medicine side, I know that was one of the biggest concerns. You want everything to work well, and you don't want to get sick. It's really important to consider getting vaccinated. again, to prevent the potential long downstream effects that can occur. I have seen cases of very healthy young individuals who had severe illness or who have had the some long hauler symptoms, such as brain fog in very young adults and even some adolescents. And it's unfortunate to hear that that can occur from COVID. And if you can imagine someone who is a teenager who gets COVID and unfortunately gets a long-term consequence from this illness, that will affect them for the rest of their lives, especially affects their brain or their cardiovascular system. So it's really important to consider getting vaccinated to prevent the potential severe effects.
Yeah, and that the whole issue about long-term consequences, long hauler disease is something that we're only beginning to really try to understand. I think it's a very complicated problem, but certainly the impacts aren't just with people getting acutely sick, but many people seem to be suffering from prolonged side effects from the disease itself.
There was a question. When you get vaccinated, they asked you for your mother's name. What does this have anything to do with anything? So our California immunization registry at minimum asks for a name, a date of birth, and then the first name of your mother. And that's just because there may be a lot of John Does out there, people who don't maybe have an address. So it's just one way to identify that person. There's also a lot of people who don't have a place to live, and so they still want to get vaccinated. And this is just another way of identifying them so we don't mismatch people with similar names.
I'd like to address, we have a number of parents of younger children who have high risk family members. And while my situation isn't exactly the same, I do have, we have a 5.5-year-old. Okay, I've been asked to start my video. We have a 5.5-year-old who is on a ventilator and has a chromosomal disorder that causes him to be medically fragile and physically and cognitively severely disabled. So I would suggest that you talk to your doctor. Let's say you have a first grader, you want to come back to school, and you have a younger child or a slightly older child under the age of 12 who can't yet be vaccinated. I know what we have heard thoroughly, myself with my husband and I with our son, is that, you know, vaccinating those who can, but please be aware that we have all the precautions in place at the school and we have had no spread. So individual students not giving it to one another at school. And so that does provide a level of safety, and that's been true throughout the entire county. So I've seen a few gentlemen, Mr. Christopher, and I think Mr. Luke. And so that is a question. We could also have you contact our school nurse for the district as well to talk to them, but start with your child's school that they would be attending and make sure, you know, that you have a conversation with them as well as your child's doctor.
There was a question, can kids under the age of 12 not eligible for the vaccine still go swimming? Actually, yes, kids can go swimming this summer. So I would encourage you to get the kids out there because they really need their play and sunshine and socialization. But again, when you can, try to get them to protect themselves, clean their hands. If they are in close contact with others, if they can wear a mask when they're outside of the pool, consider wearing a mask.
I'm going to just pipe in one more time in that there are a lot of questions about what's going to happen in the fall with masks, vaccinations, and distancing. Again, and I know people come in at different times. We don't know that. The state will set that with their school guidelines. We will share that with you as our district parents as soon as we know, or if you reside in another district, you'll find that out from your district as well. We expected it this week, but now we're thinking it won't be till the end of the month. And as soon as we know that information, we'll get it out to you and we'll share it with all of our families. We do not have a requirement for vaccination, and we couldn't have a requirement because children under 12 aren't even allowed to be vaccinated. And that for those families in our district, we will be sending you information as soon as we know what it's going to be like. Summer school won't be different until there are new guidelines. If the guidelines change, we will change them when they're effective. We just don't know that answer yet. So thank you for your patience.
There's a question. I was asked for my social security number when, and I was told this was necessary. I think it depends on where you get your vaccine delivered to you. If you don't feel comfortable giving your social security number, please talk to the clinic that you're getting your vaccine from. In terms of the California Immunization Registry, it is not a requirement. We are all, however, encouraged to gather information about like the zip code where you live, or again, your mother's name and date of birth, obviously. But when it comes to social security number, that's actually not a necessary identifier to get vaccinated. So again, if you don't feel comfortable giving that information to the vaccine site, please let whoever is registering you know, and see if there's any other way you can work around that. What else? Also, just wanted to make sure everybody's aware. I know that we have, so the main websites for you to go to get a vaccine scheduled, a vaccination appointment scheduled is MyTurn and Othina, but be aware that there are some websites that are maybe slightly off and not quite those specific websites. Please go to one of our county website or the state website to get on to get registered, because again, there's going to be some scammers out there who have bogus websites trying to collect your information. So again, you should not be asked that specific, like your social security number on even Athena will not ask you that. So if you're being asked those questions, you may want to just consider calling our hotline or go to MyTurn instead. Also for the state incentive program, there are some scammers also trying to get everybody's information, trying to tell you, hey, log into our website to get entered in. Again, everybody who has actually received a vaccine at any of the state clinics or even your local clinic, your pharmacy, all of us are required to report whoever got vaccinated, what they were vaccinated with. So that's automatically entered to the state. You do not need to provide further information. So please, if you find strange websites or people asking you strange questions, please either contact the county or the state to get clarification. I think we have time for another question. Is there any other question that you see on the chat that maybe we can answer?
One question that hasn't been translated yet is regarding losing one's sense of smell after having COVID. Do you recommend any resources or any place to learn more about regaining that sense of smell?
Ooh, I haven't heard of any treatments for that. There's so much that we're learning about how COVID actually affects the nerves. So I don't have any recommendations, or then we're all going to have to wait for more information about that.
Yeah, I would talk to your doctor, and they may be able to refer you to your nose and throat specialist. There may well be people who are looking at what might be, effective treatments, but I haven't heard something, that has made a significant difference. It seems time, but for some people that's fairly short, and for some people that's quite prolonged. And whether that's part of the long hauler syndrome for some individuals, I don't think we know yet.
Well, we want to thank Dr. Zimmerman and Dr. CK. I put in the chat the California Department of Public Health website, because just as a reminder, our wonderful doctors here are representing our county, which is one of the many counties in the state of California. And so the state of California is who dictates the health rules and regulations for schools and other entities. And then that goes down to the county level. And these wonderful doctors have been so helpful to us. We know there's a lot of unanswered questions. As we mentioned at the beginning, we don't know yet what the guidelines are going to be for masks and distancing in summer school or the fall. Right now, they've stayed the same. As soon as there's a change, we're going to inform all of our parents and families. Will be in regular contact over the summer. We do not have a requirement for vaccination. And if your children are unvaccinated, you can feel completely safe sending them to school, because we have all of the precautions in place to protect your children. We have had no spread of COVID-19, and we want you to feel comfortable sending your children to school in the fall. We will have the Virtual Learning Academy for grades 2 through 12. For kindergarten and first grade, I would encourage you to contact your children's school and to talk to them about the different options. There are options for the very youngest ones as well. So we want to thank you for your time today listening. We're just hosting it for the county, but we really appreciate our OCHA being here in order to support all of our parents. And of course, your vaccination of your child for COVID-19 is your personal choice. And no person under the age of 18 can be vaccinated without their parent present in Orange County and without the parent giving permission. So that is your choice. But whether you choose to do that or not, we do hope that you do send your child back to school in person, and that we have all of our kids back to us in Garden Grove in the fall. The best place to learn is in the classroom. And we have seen that all year round as our schools have reopened. And we're very thankful for the OCHA for supporting us. So thank you for joining us this evening. And that concludes our webinar.
Thank
you.
you.